Welcome to the ANEW Body Insight podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. And Chantal Donnelly, physical therapist and author of Settled, How to Find Calm in a Stress-Inducing World. Here at City Club Los Angeles, we follow our guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back to the ANEW Body Insight podcast. We are back for the second half of our interview with board-certified urologist Dr. Jeff Loh-Doyle. Dr. Jeff gave us some invaluable insight into the misconceptions, psychological factors, and some of the treatment options for erectile dysfunction. And we cannot wait to learn more. Welcome back, Dr. Jeff.
Thank you. I could talk about this for hours.
Yes, me too. It's so exciting. So, we have talked about psychological factors. We have talked about some of the treatments. We have talked about some of the contributors to ED. What about lifestyle? How important is lifestyle in the management and the treatment of ED?
So there's no mystery behind this. If you have a patient that doesn't work out, doesn't eat correctly, and is overweight, so each of those issues can impact erectile function. So I'll tell someone, I can give you all the medication in the world, but if you don't change those things, that no matter what, that erection will continue to decline. And these medications are just Band-Aids to the problem. So there's also an opportunity to reverse some of this. And so if you look at the data, if you look at each of those things we talked about, weight loss, exercise, and a better diet, each individually can improve erectile function parameters after 6 months.
Yes.
So if you combined all three, obviously they'll work together.
Yes.
And so I always recommend patients to just eat less, work out more, and to lose weight. I mean, obviously within reason, but overall the American diet is to eat too much.
Oh, absolutely.
So eat less and eat healthier, I think is really important. Obviously sleep matters too. But I will tell a patient, I said, Doc, what can I do? 5 days of exercise, moderate cardiovascular exercise. And I guarantee you after 3 or 4 months, the erection will be better. And also your testosterone will be better too. So we know that just exercising and building muscle mass will improve your own innate testosterone production. And testosterone in itself is a separate talk completely. But we know that testosterone also can contribute to better erections or poor erections. And so we want to do everything that your body can do to improve erectile function. And it's that simple. Work out, eat less,
Yes.
and lose some weight if you're able to.
Well, I'm also a dietitian.
Yep.
And so I'm very interested in this aspect. We always kind of hear this broad, eat less, move more. But I think it's really important to really hone in on what are you actually eating less of? What are your suggestions as far as the type of diet? For example, would you see better erections with someone who maybe follows more of a vegetarian lifestyle, maybe has a little bit less saturated fat in the diet, or is it the opposite? Are you seeing any kind of correlations with the type of diet in particular?
Mediterranean diets have better erections. And so less red meat, more fish, more olive oil, more leafy greens. But that also allows you to indulge a little bit, and that's okay. And so there's nothing wrong with enjoying what you want to have. I'm not telling people to deprive themselves of what they want to have. If you want to have your double-double, enjoy that double-double. But you have to balance that out with, maybe having some more leafy greens.
Yeah.
I need to give credit to my wife. She's a big proponent on celery juice. So she has celery juice every day, and I have celery juice every day, and I have an apple every day for breakfast. And it has really powerful antioxidant cleansing properties. And I think that overall it just creates a really good mindset for health. And then, I think that, minimizing the red meat, not eliminating, is important. But also, if you have other issues too, I mean, if you're a smoker, you got to quit smoking. I mean, these are obvious things that I get are not easy, but these are things that you can eliminate. And what's very funny is that I'll have a patient saying, doc, I've never been motivated to lose weight or exercise. And it's like, well, do you value your erection? If you value your erection, you got to do these things, or else you can kiss those issues. You can kiss your erection goodbye. I guarantee you that.
Yes.
And so maybe, their wife's been motivating him to work out. They won't listen. So the one thing that can get them motivated is like, well, you want to save your erection? This is what you got to do.
Right. Well, I think we're kind of in a, sort of a bro culture as well when it comes to protein consumption, especially animal protein consumption. And there's been a lot of studies to show that that may contribute, having a great proportion of your diet being animal protein. And I think in this country, you go to any restaurant and half of your plate is going to be animal protein.
Yep.
Do you think that that's a direct contributor to the difficulties? Obviously, saturated fat contributes to heart disease. It even contributes to diabetes, other age-related diseases, and cancers.
Yep.
So it has to be related, correct?
Yeah. I mean, I think that it's really what type of protein, too. I mean, there's this, there are diets out there that really say, oh, if you just maximize protein, you're good. But that also doesn't take into account that some of these proteins are rich in sodium and saturated fats as well. So I think it's just all about, there's a lot of gimmicks out there. And I think that there's really, what I try and portray in my clinic is that I'm not gimmicky. I mean, this is just, there's really, it takes discipline, it takes effort, and it takes not just diet, it takes also just being active and healthy. And there's, I get it. There's also genetic disposition for some folks. I mean, sometimes there are some folks that just, they do everything they can, they just can't do it. But I think that overall, if someone is having a lot of red meat, 5 or 6 meals a week, I mean, that adds up at some point, because we know that having an erection is very much dependent on cardiovascular health. And, no one would argue that eating more red meat is good for your cardiovascular health.
Yes.
I mean, that's definitely counterintuitive.
Yes. But I think it's really not even just red meat, it's the saturated fat itself.
Yeah.
And you're getting that with pork, you're getting that with chicken, and especially with chicken, they're injecting it with so much sodium too.
Oh, that's where I'm really a big proponent of getting, organic meat whenever possible from the farmer's market. And, sometimes that it's not, there is a cost associated with that, but there's actually now ways of getting organic meats online, not necessarily in a grocery store, that makes it very cost effective too.
Yeah, absolutely. And I think if we look at the blue zones, you can see too that their diets are primarily plant-based and have, smaller amounts of saturated fat, and these guys are living to
and no smoking
well over 100.
and exercising, like in Loma Linda and Redlands.
Yes, I know Loma Linda is like kind of this, unique little pocket in the United
Empire.
States.
Yeah.
Exactly.
Yep.
But they're one of the healthiest, and they're mostly vegetarian and vegan, which I think is really interesting. Now, you said exercise. What are your suggestions for exercise? Because we hear a lot of different things. You should do steady state cardio. No, that's not good. You got to do strength training. What do you think is the best for men's erectile health?
So I think all of it. I think that cardiovascular exercise, though, so moderate levels of really getting your heart rate up, I think that's critical for having better erections. You can't just focus on strength. It's not going to really help your erections. But I also think that building up muscle mass is also important for testosterone. So I think that if someone's able to integrate all of it and blend it, I think that's a good option.
Yeah. What about going back to gym bro culture?
Yeah.
What about people who take a lot of supplements or who may, even take steroids? How does that affect?
Oh, yeah. We, fortunately, so I personally don't treat low testosterone in my clinic, but I used to. And a lot of what we saw was that patients would come in saying, I need testosterone. And you look at them, they don't need testosterone. They've got plenty of it. But now, there has now been online pharmacies that have made testosterone therapy a lot more easier to access. And so it's very much about identifying who are the patients that truly needed it, and maybe some of the patients that are just maybe microdosing it or boosting their own testosterone production, because that absolutely may have some downstream consequences for their fertility and other issues. So yes, it's all about looking big, but sometimes you're looking big externally at the expense of maybe looking smaller down below, and that's something that you don't necessarily want.
So if they're taking testosterone, that could lead to ED?
Well, their erections their testicles are definitely shrinking.
Whoa.
All right. So I wouldn't say that testosterone supplementation will impact their erections, but I think that it has downstream cardiovascular side effects that have to be factored in. It's not what's happening to their erection now, but what's happening to their erection maybe 5 or 10 years later. Don't know.
Interesting. And steroids. That definitely contributes to ED?
No, it's definitely more related to what happens to their fertility and also just the overall impact on their overall health.
What would that be?
So, it definitely affects their fertility. So if you take someone that is taking testosterone, you suppress your own body's ability to make testosterone, but also sperm production. So it's governed by the same pituitary axis. Also, you can have anabolic steroids that can also impact just overall health, including your cardiovascular health, and it can lead to atherosclerosis and other issues too.
Yeah, that's why you're hearing about, the biggest gym bros having sudden heart attacks and dying at a young age.
I just think that there's, forever people have found ways of just, doing things to really not help their bodies.
Right.
But it's our job to kind of educate them that you can make your own choices, but there may be some consequences for what you do.
Absolutely. Well, let's shift it. Let's talk about couples.
Yeah.
Let's talk about the communication needed between couples, especially if they are experiencing, if the male partner is experiencing ED. What do you suggest for couples to increase their communication?
So we always encourage couples to at least come in if they can. So what's more often the case is that the male will come in and they won't tell their partner about what's happening, or they're just too ashamed to really talk about it. But it actually took them a while to even see us. So we first congratulate them on coming in to see us because that's a big step. And then we talk about, this is not just about, a physical issue. It's also involves an emotional connection. And so the best success are the folks that come in that have a partner that says, I'm willing to work with you. I'm willing to, to kind of go with you and not shame them.
Yeah.
Because we definitely have some patients out there, and it's just really, it's so unfortunate when they come in saying, my wife is going to divorce me because I can't just pleasure her.
Yeah.
And that's crazy. That's really wild where, having pleasure doesn't, you don't need to have penetration for pleasure. There's other ways of kind of doing this. So it's very much awareness from a couple standpoint to say, look, it's not just about getting it in. You can figure this out.
Yeah.
And so there's sometimes a lot of marriage counseling that we have to do as well. But if you have the partner involved and they're bought in to just helping their husband or their boyfriend or whatever, I think that's really helpful.
It absolutely is. But I think that a lot of, their partners, they internalize it as it being something wrong with them, or maybe they're not attractive anymore.
Yeah.
What do you suggest in that case? I know you're treating the man, but you're also treating the couple. How do you encourage the other partner to not necessarily take it personally?
Well, it's all about counseling. We have to provide reassurance that, we have to review their medical history. If they had their prostate taken out or they've had bad diabetes, it's not how they look, it's not how sexy they are. It's just a physiological issue. It's no fault of their own. It's just overall health. But there are some patients that are maybe younger, and you can provide data. So you can give data to the patient that they can give back to their partner. And that can simply just be with a penile ultrasound. And that can just show physiologically what's happening with the arteries and veins.
Yeah.
And they can just say, look, I'm excited. I really think that I'm sexually stimulated by you, but I just can't do it. I mean, my body won't let me. And so once you kind of tell patients and their partners and you educate them about it, I think that really helps break down that barrier to say, all right, well, what can we do? How can we work through this?
Yes. And I see couples too that experience this. And I think what I tend to see on the psychological end, if there is that contributing factor, not to say that the partner's doing anything wrong or anything like that, but oftentimes if there's stress and strain in the relationship, very poor communication skills, a lot of, kind of volatile fighting, that can also lead to, difficulties in the bedroom. And so I always encourage all couples to go and seek some psychological help as well, especially if they're also doing, some medical treatments, because you can never, do harm if you're trying to improve your communication.
Yeah, I mean, if you're not communicating, sometimes we as urologists have to do a timeout. We're not good about this. I mean, we've got a couple that's bickering in the clinic room with us. They're like, all right, I'm going to back out of this room slowly. But this is where...
You can send them to me.
Yeah, exactly. I'm like, okay, I think we need to take a break and we need to talk about things. But I'm not the best person to talk about this. But we have to identify those issues. I mean, if I say, all right, well, I could do all these things, but if you two aren't getting along, there's nothing that's going to make this work.
Exactly.
It's not your erection that's the problem.
Yeah.
There's other issues that are going on. And, if you guys really despise each other, how are you going to get an erection?
Exactly. So working on their communication together with a therapist, I think, is super important, along with seeking some medical treatments. And speaking of which, what are the advancements? There's all sorts of new and exciting treatments out there. You've talked about the penile pump. Is that what you call
the penile implant. Yeah, penile
what
implant. There's cool things happening in the penile implant space. But also, that's a quote-unquote very, I wouldn't say extreme, but that's for the patient where nothing really is really working. It's very rare when someone says, I want a penile implant, but they haven't tried oral medications or they haven't tried gels. So oral medications, we all know them, the little blue pills, they've been around. They still work really well. That is absolutely our first-line therapy. And for me, at least, it's always worth trying someone out on those medications.
And what did they do exactly for people who
just
don't
improves
know?
blood supply. So what it does is that it relaxes the plumbing in the penis to allow more blood to flow into the penis a little bit more efficiently. Okay?
Yeah.
And just think about your erection like being a really simple but sophisticated bathtub. You need to have enough blood flowing in, but you need to have that stopper that keeps the blood in place. If you have a problem with the inflow or a leak in the outflow, that's when you start getting physiological or vascular erectile dysfunction. So what the medication does is that it just improves the inflow. And so that's something that can be taken either daily or it can be taken as needed. There's no right or wrong answer. That's where we talk about, what are your lifestyle goals? Do you date frequently? Do you have a set time? Do you have a Friday night that you always plan on having sex? Then you can kind of time those things accordingly. But you also have to counsel patients how to take it best.
Okay.
Beyond pills, there's also gels. There's topical gels. And there's actually now a medication that just got approved in the U.S. that was available in Europe that's a topical as well. So that's something for patients to keep an eye on as well.
And what do they do?
And so you just put it on the penis, and then it theoretically allows an erection to happen. So it's worth experimenting with. Yeah, just improves blood supply.
Interesting.
Yeah. And so that's on the horizon. And then there's also injectable therapy. So injection therapy has actually been around for a long time, even before oral medications. So you actually inject your penis with a very, very small needle just before you want to have sex, and it goes directly to the target, the penis, and it makes the blood vessels relax, more blood to flow in, and it works. So it really works well in certain patients where pills just don't work.
And patients who aren't afraid of needles on their penises.
That's the biggest thing, is that it comes to us to decide, is this person, so we teach them first, and we do a diagnostic injection. If they're needle phobic, we're not gonna be friends. We just can't do it. And that's someone that we maybe have to talk about doing a penile implant on.
Okay.
And lastly, there's new things like stem cells, and there's also shockwave therapy. So shockwave therapy is now gaining some traction. There are some clinics out there that are doing this, not necessarily run by urologists. So you have to, for any patients that are listening, you have to really make sure where you're going and what their training is and what type of machine they have. Because there are some people that will just sell you the world and that it's really expensive and it's just not going to be effective. There's a few machines out there that may be effective.
What is it supposed to do?
So what it does is that it's just shock waves are meant to actually stimulate new blood vessels to grow. So by actually stimulating new blood vessels to grow, you're going to make the penis healthier. So, that's also something. There's still trials out there investigating the durability of these treatments, but there are some promising results in certain patient populations.
Okay.
So, there's exciting things happening in the regenerative space, including shockwave therapy, where, can we do something beyond Band-Aids like pills? I mean, can we actually allow tissue to be healthier?
Well, tell me a little bit more about stem cells. How is that used?
So stem cells have been studied for decades. What's really interesting is that there really hasn't been a lot of traction in the erectile dysfunction space in a meaningful way. You're going to have some clinics that will inject stem cells and they'll promise, oh, this is going to make your erection great. So $5,000 later, what's going to happen? Nothing. Or there are some patients that have an anecdotal success, but there's been no trials to show in a meaningful way that it's better than the placebo or durable beyond X number of months.
Do you think there will be?
Yeah, I think that there may be a time where they just find a way to keep the stem cells in place to actually stay in the target organ. But right now, we're still having some issues with the durability of stem cells.
Interesting.
Yeah.
So what are your suggestions for men in overcoming the stigma of ED? We talked a little bit about that before, but what are your main takeaway points to anyone out there who might be suffering from this and suffering in silence because they're ashamed?
So suffering in silence is a really, really great term because men suffer in silence from a lot of things.
Yes.
Erectile dysfunction, urinary issues, urinary leakage. You're just kind of being a man is to persevere through this and just to deal with it. And I think that the first step for any male patient that is experiencing just something that just doesn't feel right is they should seek out medical care. Because that could be an indicator that there's something amiss. And then it's our job as medical professionals to discern, all right, well, what's going on? What's the underlying issue? How can we solve this for you? Because there's great treatment options out there. I mean, there's really, really good treatment options. And now the good thing about kind of the internet is that there's now more direct-to-patient access just online. I mean, you don't necessarily have to go to a doctor's office. I mean, you can just go see us via telemedicine, and we can talk about these issues. I mean, I don't necessarily need to do a physical exam to understand the problem and to try something. You may need that eventually, but as a first encounter, we can just talk about things. And if I feel like, you'd be better served seeing you, then we can do that. So we can kind of quarterback things. But we really want to let patients know that they should not feel afraid to seek out care. I mean, that's number one, because there's absolutely, there's great treatment options that are now inexpensive. I mean, and that's the other thing too, is that a lot of these medications have become generic and it's now very inexpensive to try these medications out too.
Even for people without insurance? I know there's so many people out there who don't have medical insurance.
Absolutely. And I take care of patients rich and poor, and I always tell patients, I don't care how rich you are, but I don't want you paying X for these medications. I can give you a coupon that'll make it Y so much cheaper. And if you really feel compelled to pay that out of pocket, just give me the difference and I'll give you that. So I really don't want people spending a lot of money on this because you don't have to anymore. You can get this at any pharmacy for a reasonable cost. And there's online pharmacies that are very reputable that you can get them as well.
Okay. So there are a lot of options for people, especially if they were to come to you personally. It sounds like you...
Yeah, cost should not be a barrier. I mean, that's number one. Cost should not be a barrier.
I think that's a reassuring thing for a lot of people to hear because access to health care, I think, is a big problem for many people.
What we need is more folks like you that are willing to talk about this because, there's enough urologists, but there's not enough mental health professionals that are really trained to talk about sexual dysfunction. I mean, they're really, really important in someone's care.
Absolutely. So let's talk about how people can get in touch with you. How can they work with you?
So they can just access me via the USC website. So there's a great portal online where you can schedule appointments online. And then there's also just 1-800-USC-CARE, or our urology office, which is 323-865-3700. And just ask to speak to my scheduler, who is Renee, and they can facilitate an appointment.
Now, say for the people who are not in California, is there like a national center that they can go to for more information and for ways to find help?
So there's a great website that's called ED-Cure.
ED-Cure.
And that has a really great list of urologists that are specifically trained to offer the gamut in erectile dysfunction treatments, including surgery. Wow. And that'd be that's a great place to start.
Wow. Okay. Lots of options for you guys. We have some time right now to open up to our audience for some questions for Dr. Jeff. Does anyone have any? Yes. Come up. Whoever. The mic is right there.
Hello.
Hi.
Thank you for the great talk, Dr. Loh-Doyle. I have a few questions regarding the penile implant.
Sure.
It seems like it's very effective and a great solution. Are there any patients that cannot receive this implant? And is there any age restriction? Can someone that's 30 receive the same implant that someone that's 70?
Great questions.
Yeah.
So what are the contraindications to a penile implant? So anyone that has an active skin infection should not receive a penile implant. But for the most part, a penile implant can be placed in anyone that has erectile dysfunction. So number one, so that you have to make sure that they have erectile dysfunction. And you bring up a great question about the younger patient. So we have some patients that they have strictly psychological ED. You want to be absolutely sure that they also have a vascular issue as well, because a penile implant is great. But if you're young, these are mechanical devices. What happens to every mechanical device with time? It can have a failure rate. So if you're young, we're now almost guaranteeing someone that they may require numerous operations in their lifetime. So you want to be absolutely sure that they also have a vascular component of it. So that's where we try these younger patients on every single type of treatment option. We'll do a penile ultrasound just to confirm that there's an actual vascular issue. And then we'll decide, okay, after appropriate counseling, all right, this is your best option. Conversely, is there an age limit? I mean, the oldest person I've done a penile implant on is 90.
Whoa.
Very healthy 90. So it's very much dependent on the health of the patient and what their body's able to tolerate. Obviously, the older patients have to go through appropriate anesthesia clearance before we do any sort of outpatient surgeries.
Oh, 90.
Perfect. With the penile implant, can it increase the size of the penis as well?
So that's the $1 million question. If I could increase someone's penile size,
You'd be a very rich man.
Yeah, I'd be very wealthy. So that is probably the second most common question I get is that, okay, that's cool and all, but can you make my penis bigger? So I can't make it bigger than what God gave you. All right. There are things and there are surgeries out there that can maybe make girth better. There's actually now fillers that have become available that are quite good and safe. There's also another implant that also has had some success. But the implant itself that we're talking about, the inflatable implant, is strictly to give you an erection. It's meant to inflate and deflate to give you a functional erection. So when I counsel a patient is, I can't guarantee any size outcomes except that I'm going to do my absolute best to give you the largest implant that your penis can fit. If you're a size 12 shoe and you want a size 14 shoe, you're not going to be able to run on that. So I always tell someone, we have to give you what fits properly, what your anatomy allows.
Yeah, and one last question. Regarding prostate cancer treatment, I know it's very common for people to experience erectile dysfunction after prostate cancer surgery. Is there an appropriate time for men to seek help? Should he wait 1 year after surgery, or is there any signs that would take him to a urologist beforehand?
My suggestion for anyone is that they should see a urologist that specializes in erectile dysfunction even before their prostate gets taken out to discuss rehabilitation strategies. So there are strategies available for patients after their prostate gets taken out to make the penis healthier. Now, it can take anywhere between 6 months to 2 years for erections to come back, and there's no guarantee in some patients. So what can you do to maximize the success or likelihood of recovery? Well, there are some medications you can take. There's exercises you can do. There's supplements that you can take. You can use vacuum erection devices. So if you have in your practice the ability to see someone besides the prostatectomist, besides that oncologist, who also just specializes in what we do, I think it's very helpful because you can also involve the partner. I mean, it's very much gets them involved, but also sets realistic expectations, which I think is critical.
Wow. Okay, I think we have time for one more question.
Hi, in keeping with the penile implant, you mentioned you've implanted them on someone up to 90 years old. But what is the shelf life of a penile implant?
So 10 to 15 years is what I quote patients, but that's with normal use. Now, that's very much dependent on what normal use is. We have some folks that are using it daily, and they're using it. Congratulations to them. If you're using that, you may break it sooner. If it breaks, then you fix it. So it's really your penis won't fall off. It just won't stop. The penile implant stops working. You just replace the parts.
And the penile implant hasn't really changed much that I'm aware of in the past 40, 50 years that it's been around.
Yeah.
What is the future of the penile implant? Are we ever going to have a remote control penile implant instead of pumping it up the old-fashioned way?
So that's going to be happening sooner than you think. So there's absolutely things heading in the right direction to make it as you would envision. Wouldn't it be cool if you could have something that's controlled with an app that is on demand that will just be a little bit more spontaneous? So keep your eyes out because it's definitely happening.
It might be good for the couples. Hit it on the Apple phone and say, hey, let's go.
Yep.
Or I can control
Female
it.
controlled.
So, exactly.
It's time.
And in my final question, you mentioned a lot of younger men with erectile dysfunction. Do you see a lot of patients that are experimenting with ED drugs, and that's also contributing to their erectile dysfunction?
That's a really good question. So are people just taking it for sport rather than a necessity? Absolutely. I could think about 3 or 4 of my friends that do that. So, and that's where it comes down to the dating culture now, is that, there are options where you can meet lots of people quickly. But if you want to be like the guy every single time, there is some pressure where you actually feel like I got to perform every single time, new partners, new experiences, and you want to leave that lasting impression. So absolutely, I think that because medications are easier to access and they're cheaper now, you definitely have people taking it for sport. But at some point, does that create a dependency, whether it's either physiologic or mental? Mm-hmm. Yeah. So we do have to sometimes uncoach that. We have to get people out of those dependencies.
Yes.
You're probably seeing that as well.
Oh, yeah. Absolutely.
Yeah.
My question is along the similar lines. Great talk, by the way. What do you notice when people that are younger, they go on websites such as Hims to get a prescription for Cialis or Viagra? And how do you think that has impacted the overall culture behind ED and seeking a urologist?
I would say that it's really made access to care easier. It's raised awareness. It's destigmatized these medications, for good and bad. Yeah. Because it has made things more accessible. Mm-hmm. I'm not going to go into cost. People should just do their own due diligence when it comes to these medications. But what I would say is that medications are very easy to access now. Yeah. At a very reasonable rate from pharmacies here. Mm-hmm. But I would congratulate those websites for at least raising awareness and kind of making us even busier because, there are some patients where medications don't work. And so if things don't work, then they have to come to us for a little bit more of a different option.
Yeah, I actually think it's a really good thing. I think it helped to reduce the stigma. I think people feel more comfortable oftentimes seeking that out at home first and then trying that out. And if it doesn't work, then I think that they're fueled then to go further. So I think it's a really good thing. And I think what you're doing is a really, really good thing.
Thank you. You as well.
And we are out of time now. And this was a really fascinating episode for me. And I think hopefully people got a lot out of this. And we can reduce that stigma. We can get people in. We can get help. because there's plenty out there and a lot more on the horizon. So thank you so much, Dr. Jeff, for coming and speaking with us today.
Thank you very much. It was fun.
Absolutely. And thank you all for joining the ANEW Body Insight podcast here at City Club Los Angeles. We are looking forward to our next exciting interview, and we really hope you join us. Thank you, everyone, for being here. Thanks for tuning into the ANEW Body Insight podcast. Please remember, the content shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Body Insight podcast tab. Follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.